Good afternoon. Thanks for taking a few minutes. This is Steve Bullock, and I wanted to provide an opportunity as we kick off June and the start of phase 2 to talk a little bit about the cases that we're seeing in Montana right now, because as we enter into phase 2, we can recognize that there are 40 new cases last week. We have 22 active cases in Bighorn County, 12 active in Yellowstone County, and that's the vast majority of actually active cases in our entire state. Early on, as we were dealing with COVID-19, there was a lot of discussion about community spread. And community spread is when you really can't figure out where a positive case might have gotten the disease. And want to underscore that for every positive case we have right now in Montana, there's not one case in Montana where we haven't been able to identify exactly where that positive transmission came from. So I'd like to have our state medical officer, Dr. Holzman, speak a little bit about what we know about Yellowstone and Bighorn counties, and then open up for any questions. Dr. Holzman.
Thank you. Yeah, just a real quick overview. As Governor Bullock mentioned, we are seeing increased cases in 2 clusters, one in Bighorn and one in Yellowstone. At this point in time, we're still in the investigation, but all of the cases have been connected in these 2 individual clusters. So we're not seeing community spread at this point in time in either places, but we want to continue to get in front of it with our contact tracing to make sure that the outbreak does not get larger.
Be happy to open it up now for questions if there are any. First question.
Hi, Governor Bullock. This is Marisa Giorgio from NBC, Montana. I'm wondering, because Bighorn County has half the state's active cases right now, what kind of resources additionally is the state offering them to help? And also for people who don't understand, what are some of the reasons this seems to be hitting the tribal communities so hard?
Maritza, so the first question was, what additional resources are we providing? And to note, even a few of these cases, the positive cases were found through the drive-through testing that we had worked with both the tribe and Bighorn County to set up last week. I know that the state medical officers in regular consultation with both Yellowstone and Bighorn County to ensure that they have all of the contact tracing resources necessary. Another thing that I'd point out is even from when this began, what we used to do, we've changed the testing protocol so that those around a positive case are more apt to be tested rather than just being quarantined. As far as why it's broken out in a tribal nation, I think part of this is that this underscores that this cluster could happen in any of our communities if we're not very, very careful, in as much as that we have identified sort of where the breakouts occurred. And I think, as the doc said, it's a very defined area, meaning defined groups of people that we're all together. So it's just a reminder that all of us should be certainly careful, and we need to continue to be vigilant. Next question.
Hi, Governor. Oh, hey, this is Holly. How are you doing?
Good, Holly.
Good. So I've got a question, I think maybe for you, Dr. Holzman, and I don't know if Jim Murphy's there too, but I had talked with you all last week about the low case growth trajectory that we've seen in Montana. And I just wanted to follow up on this question and conversations we had last week, given
these new clusters that we saw. I'm sort of wondering how this fits into the narrative for you, if it still feels like we're on a lower case growth trajectory given the clustered natures of these and the ability to contact trace, or if you're feeling a little bit differently about, we talked about everyone's been good, surprised that case growth has been so low. I just wanted to kind of touch base again on that, given that the situation's changed a little bit since we spoke about that.
Yeah, I think what we were saying is it's the same. I'll quote Jim Murphy because he's not here right now, but as when we were talking at the time, we said one of the things that has not happened in Montana, which has been very lucky, is we haven't had a meatpacking scenario or something like that where you start to see big spreads, but that can easily happen. If you have a positive case that comes into one of those, when you have congregate settings, that's where you're more likely to see higher numbers and quickly. And we expect that, I would love to say that these are going to be the only outbreaks that we're going to see, but to be realistic, I think we'll see more of these type of things. Now it's the matter of using contact tracing and others to try to minimize where it spreads to. And doing testing quickly is one of the modalities we're using to try to get ahead of the wave of any kind of outbreak. The things that Montanans can continue to do is use all the social distancing things that we have been talking about, washing your hands, every ones that you've been hearing about, and to think about any large congregation that you're being in. When you're in those groups, we're talking about people who are going to have larger groups getting together now. That doesn't mean that group has to all intermingle and be real close together. You still want to use all the social distancing in the areas that you can to protect one another. And if we do that, I think we can keep this at a minimal level.
Next question, please.
Hi, Eric Richard of the Montana Free Press. Thanks for doing this. So I just wanted to check in and see where all in the state we're doing surveillance testing right now. And then as a follow-up to that, was curious, are we seeing more cases in Bighorn or more known cases in Bighorn County because there's more testing there, because there's surveillance testing being done there?
To the latter question, Eric, we're seeing, I think, more cases in Bighorn County because there was, in a small group setting, more or less a congregate setting, a positive where the transmission occurred, and it's the contact tracing that's making it so that we're actually identifying the individuals along the way.
And I would just add on to this is Dr. Holzman, is that the idea of the large screening is try to find asymptomatic people early so we can try and prevent events like this from happening, or even to understand how much of the virus is really out in our communities. And so we continue to do that, but I don't... Just to continue, I think a lot of the data that has shown over time is that the virus is probably fairly little in Montana at this time, but that could change very quickly as we're seeing. But that's what the surveillance screening is doing, and that will continue on to continue to monitor. Are we seeing an increase of disease in the community that we didn't know about?
Next question. Nikki? Phil? Have we lost it?
Governor, if I could ask a question, I have one. Knowing that there's a small outbreak in one of the Yellowstone detention centers, are you concerned about any of the other facilities around the state?
We are, and I mean, we're concerned with any congregate setting from that perspective, and we want to make sure that testing is available and can occur there, for sure.
And as we enter phase 2, what are the other different concerns that you may have as we're going into that phase? Yeah,
I mean, the concerns that I have as we enter into phase 2 are the same that I've expressed all along. Come on up, Jim, too. Those are concerns that Montanans need to continue to take this seriously. The virus is still within our state,
Your 6-digit conference.
and we need to take steps to be serious about both continuing social distancing, making sure that if you have any symptoms, getting tested, and following along from the contact tracing along the way. I mean, we know that as the virus is still here, we will have additional flare-ups. One of the reasons why we wanted to do this, it's not like community spread has occurred significantly, have that degree of confidence in as much as that we know exactly where these cases came from, and we're doing the work to both isolate and quarantine as a result. Please.
Just one thing to add on about the testing within the prison system. We're moving forward in getting that all set up and going. As far as detention centers at the community level, we're reaching out, and if anybody, we help them get testing done in those facilities, and if anybody would like to get testing done sooner rather than later, they should be contacting us. Detention centers.
Are we back live?
There we are.
Nikki?
Hello?
Hey, Nikki.
Hi. We're back. I apologize if you are re-answering this, but I didn't hear where the first case in the Bighorn County cluster came from, and I'm a little confused about your definition of community spread, because if the new cases are being identified through contact tracing, that means that it was picked up somewhere in the community. So wouldn't that indicate that the virus is spreading locally in Bighorn County?
So one is an epidemiological definition that we talk about with community spread. We will say that there is community spread going on in a community when we find cases and we cannot explain where that person got the virus from. If we can track that all the way through, then we do not say there's community spread. There is a cluster of people that have gotten the virus in this area, but we were able to identify those individuals and move it forward, but we're not finding, there isn't anyone that we're finding that we don't know a connection of where they might have gotten the virus from. Do you have anything to add to that, Jen?
No, I think that covered it. I think we've been fortunate not to have a lot of community spread, and this is definitely one of those instances where contact tracing shows its value.
Next question.
Hi, this is Phil from the Tribune.
Hey, Phil.
I was just wondering, has this given you any pause about moving forward with the phase 2? Or is there any way that just certain portions of the state would be under phase 1 while the rest of the state moves into phase 2?
Phil, for the exact reason that these are just a couple of discrete clusters where, you know, we have identified through the contact tracing exactly what's happened with the virus, it doesn't give me pause on entering into phase 2, but wanted to have this for that exact reason. When someone sees additional numbers last week thinking that, well, this might be spreading quickly throughout our state, we have a couple identified clusters which we're working with local public health to make sure that those stay contained.
Would you all
Oh, sorry, go ahead, Phil.
consider making the state under phase 1 while others move into phase 2? I'm sorry if you already answered that. I just...
Was the question, would I think about keeping some areas under phase 1 while we move to phase 2? Look, local public health could always and can, and certainly our tribal nations can be certainly more restrictive than statewide directives, but there's nothing that occurred over last week that would make me have thoughts of limiting some areas and keeping them in phase 1. Nikki, another question.
sorry. That first case in Bighorn County, do we know where that person picked it up?
So this is Jim Murphy. Just a quick comment on that. We know that there's been some continued case activity in the Billings area and the Bighorn County and Crow Tribal area. So we think that some of this was just background case activity that we found because of the mass screening efforts. So I think it just kind of underscores the fact that there may be asymptomatic individuals out there that are a little bit below the radar until they have the opportunity to get tested. So pretty sure that the testing there helped us identify a cluster before it developed into something much larger. So I think we're on the right track.
Thank you.
Holly.
If you already answered.
What was that, Holly?
Are you guys there? Hey, sorry. It's sorry if you guys already answered this. It cut out for a bit. But with the Bighorn cases, I'm wondering if you could say if they're in a situation where, and we've talked a lot about this in some of our communities, but many generations living under one roof, and if that's the case, how quarantine and isolation are going, if there's any sort of how efforts to separate people are going, if there's any special steps to be taken, or what that might look like down there.
Sure, this is Jim again. So I think the event down in Bighorn County and Crow Nation kind of underscores some of the challenges to isolation and quarantine. The county and the tribal health department are both working very closely to try to make sure that everybody is isolated and quarantined as the recommendations call for. It can be a little bit more challenging, and I know they're looking at some creative ways to address that with housing, for instance, to help separate those that are being isolated. We don't have as much concern about people being quarantined. I mean, people can be quarantined together fairly safely in a household with minimal, with minimal resources being required. The cases, that, however, are a little bit more involved, so the isolation can be a little bit more complicated. Fortunately, they're all working together to address those concerns. And because we do know what is going on with these households that are involved, they're being watched very closely, and we hope that that will help resolve the situation.
Another question?
Go ahead.
Hi, Governor Bullock. It's Marisa again from NBC Montana. I'm wondering if you could talk about the complexity of managing two major crises together, COVID-19 and the national unrest over the George Floyd death. I mean, we had more than 1,000 people protesting in Bozeman yesterday alone, all in close contact. And also, were you on the president's call today? And if so, what's your takeaway from it?
So the question was dealing with two crises at once, and was I on the president's call? First to the, George Floyd case, and we need to recognize that, people across this country, indeed, many Montanans are in pain, and we need to protect avenues for people to express those First Amendment rights. Doing so can be done lawfully and peacefully. As Montanans make their voices heard, we need to continue to demand accountability, seek justice, pursue progress peacefully. We have to be working toward a nation where no one lives in fear of being treated unjustly by the very people who are supposed to protect them. Look, as Attorney General and as Governor, I've worked with some incredible peace officers that go to work every day for the betterment of their communities and their state. We know across the country not every peace officer holds up that standard, and I think the death of George Floyd is one more reminder that there are systemic issues in this country that need to be addressed. And was pleased as there were protests across our state that those protests were peaceful expressions of First Amendment rights. Even near the tail end of the one here in Helena, I and my children went over to that protest. I was on the call this morning, and I think that I'll just leave it. We need to make sure that our leaders are bringing us together as a nation. Certainly not adding further division. I've said time and time again that all of us have to act like our kids are watching, learning from our words and our deeds. And I think that's the case all throughout both of these crises. Last question.
Hi, Dietrich again. I just wanted to ask again about kind of the status of the expanded testing that been announced a couple of weeks ago, and where all in the state we're doing widespread community surveillance testing.
Well, I think, Eric, at this point, and either Doc Holzman or Jim could add on, I mean, we're doing significant amounts of testing in congregate care facilities. We've added and opened up into our tribal nations more surveillance testing. There's been some drive-through testing where anyone can get it in Cascade County, some in Lewis and Clark, some in Toole County. And we're continuing to work with both the healthcare community and local public health and our community health centers to further expand surveillance testing.
Great. And as a follow-up to that,
hold on just one sec, Eric. Dr. Holzman was going to add.
I just wanted to add that, I mean, there's logistics of getting everything going up and running and working with the different groups, but we also have, we're working with some healthcare providers in emergency rooms and urgent cares. Some communities have decided to do some things with businesses. We will, of course, as we were talking about earlier, talking about the prison system and the mental health facility, state hospital. There is also testing being done by a lot of our medical colleagues of testing people prior to certain procedures in the hospital that has been picking up and continuing on. And some of our dentists are now getting back to work and are looking to do testing, screening of individuals prior to some of the procedures that they do. And there's probably more that I'm missing, but the big point here is that we have a lot more testing equipment available and testing available, and we will work with anybody and any person to help them do some further testing in their communities where they see fit. Oh, the other places with some of the substance use facilities that are doing treatment are interested in starting up and doing testing among some of their clients. So, a lot happening. Still, some of it's still in the process of getting going.
Yeah, and thank you. And as a follow-up to that, do we have a better handle than maybe you had a few weeks ago on how much testing is being done in different parts of the state, like how many tests are being conducted each week at the county level?
Yes, so this is Jim. I can talk about that. So right now we're in the process of kind of merging a couple data streams. I'm optimistic by the end of this week we'll be able to share some information that represents the facilities and the providers' jurisdiction where the testing was ordered. It's not always possible to tell where the patient was. We have a lot of patients that seek services across county jurisdictional lines in Montana, but we do have the data. We're kind of refining it right now as we compile the data from our reference laboratory with our data from the state laboratory to get a better snapshot of where testing is being conducted that we can put out for external use. So I hope to have that by the end of this week, and we'll share it.
Wonderful. Really glad to hear that. Thank you.
I guess you touched on it probably last week, but when we talk about the protests going on all around the country, and you talked about Montana being a vacation hotspot, how worried are you about those people coming into our state, and have you thought about doing anything special with that?
As far as
people gathering, large gatherings all across our country and then coming into Montana?
Well, I think more than the protests or the large gatherings, it's just knowing now we're opening up Montana for anyone coming and tourists coming, that it's one of the reasons why, and we have reached out to sort of the 20 main gateway counties in the state, because look, we know this virus is still here. And I think both the Bighorn County and the Yellowstone County examples, and even the 1 or 2 cases that we've had in Gallatin, just underscore the importance of really getting on top of the cases early and doing the community tracing efforts to ensure that what could be a small handful of cases doesn't get out of hand, if you will. And we'll be asking in the upcoming days, within the week, we're going to be rolling out some of the public education piece, but we ask anybody coming to Montana to take this as seriously as Montanans have. Please.
The one point I'd like to put out on this is definitely concerned and working to mitigate risk for tourists that might be coming into our state. Luckily, most of the tourists that actually come into our state are coming in because of the wonderful outdoor activities. So with them, they'll come in, we hope they'll follow our rules, but they'll often stay within their family unit or the group that they're coming in. The area that we actually start to think about as people become more mobile is actually Montanans going and visiting other places and then coming back to Montana and resuming their regular life as they do. That's where you can start to get some big spread too. So all of us need to be aware, I know a lot of people don't like the word, but to this new normal of how to minimize your risk and minimize the risk of the people around you. And if we put those protocols in, along with good contact tracing and stuff like that, we can keep the economy open, which is important too, while addressing this public health crisis.
Great, thank you very much. We'll probably have a regular press avail near the end of this week, but just wanted to, as we kicked off phase 2, make sure that we could answer any of the questions about sort of Bighorn County and Yellowstone. Thanks so much, though.